One, bend your knee, 2, and 3. Up on. Here we go.
I had never been ziplining before, particularly in a rainforest. It was an awesome experience. My name is Allie Klein, and I'm a first-year Master of Public Health student at the UAlbany School of Public Health.
Welcome to Costa Rica and to the School of Public Health.
We did a service learning project through the University of Costa Rica. We got to see what their School of Public Health is like and what their university campus is like. We had a good mix of learning about Costa Rica's healthcare system, participating in some hands-on service learning, and also doing some of the exciting things like ziplining and taking a rainforest tour. We went up a mountain, quite literally, where we walked up to the community of Brumalis. We had our community health worker, and we had several people from the School of Public Health group, which also included MPH students, faculty and staff, and Department of Health and other community health professionals. Anyone who was home could get this antibiotic to fight parasites because there's such a high incidence of infection there that they give the antibiotic to everyone. All of the pamphlets explained how parasite infection occurs. I got to demonstrate the steps of hand washing, and I learned how to properly wash my hands for the first time. I'd never learned that. We visited several hospitals that were administered by La Caja Costarricense Seguro Social, which is their universal healthcare system. There were a lot of lines. There was a high demand for healthcare from the Caja. It usually took a couple hours for people to get to pick up their medication after it was prescribed to them. And the reason that they are able to have national healthcare is because they disbanded their army and took all the defense funds and repurposed them for healthcare.
We do also promote the trip to people outside of the school. It helps us identify new partners that not only can help us when we go to places like Costa Rica, but where we can create meaningful internships for students here.
I would recommend that any member of the UAlbany community who has an interest in seeing health from another culture, they should definitely contact the Center for Global Health. Because for me, this trip was an experience that solidified, yes, I'm in the right field. I want to be part of intervention design and to be able to make things like that better. It also made me realize the importance of understanding the language and understanding the culture. You can learn that in a classroom, but it's a lot different when you're actually out there observing it for yourself.
That was an experience I have never had before.